gather up your supplies. You're going to need 2 20s, 2 22s, your saline flush, your injection cap, and your IV securement kit. Okay? In the IV securement kit, it has just about everything you need to initiate this IV. You have your waterproof cloth, shiny side down. You have your tourniquet. You have your extension set, ChloraPrep swabs, tape strip, and your securement device. Okay, you want to assess the vein, try to determine on the front end which vein you're going to use. Once you determine which vein you're going to use, you want to clean the vein first using ChloraPrep. Start where you plan to insert. Rub in that spot for about 15 seconds. Then work your way out in a circular motion about 2 inches. While your ChloraPrep is drying, you can get your other things together. You can take your extension set, the blue end here, your injection cap. You usually have a blue opaque cap. You're going to remove the cap off each of the blue ends. You attach the two. Your saline flush has an airlock on it. You take the top off. You release the airlock by pulling down first. Then you clear your air. You're going to attach that to your extension set by pushing and screwing to the right. And then you want to prime that extension set. You do not have to take the cap off it. Prime it. Go ahead and loosen the end so when you get ready to use it, you're not struggling to get that cap off. Once you have that loose, you can just lay that to the side. Okay? You want to go ahead and open up your angiocath based on the size of the patient veins. Determine whether you're going to need your 20 or your 22. Pull it straight off and away. Rotate the catheter. Oh, you didn't want me to talk, did you?
No, you're good. No, keep going.
Put that in place to cover that, protect it. Tie your tourniquet about 5 to 6 inches above where you plan to stick the patient. Hold in tight, pull the other end up, and tuck. Needle with the bevel end up. Catheter is loose. You're going to pull the skin taut using your thumb and your index. Once you touch down and stick, you get your flash of blood collecting. Then you just advance your catheter. Disconnect the angiocath. Apply pressure. Unscrew the cap. Hold on to the hub. Screw that on. Release your tourniquet. Aspirate. Flush with 2 to 3 mils. If your patient is cognizant, it's okay to let that go. If not, you want to hold on to it so it doesn't come back out or get dislodged and pulled out. Secure this piece of tape over the hub and over the connection without covering up your insertion site. You want to get the largest securement device part. Remove the back off it. You want to center that insertion site in the middle of the transparent part of the securement device. You secure down from the inside out. Make sure the edges are down all the way around so there's no chance of organisms traveling underneath the dressing. You take the small portion of the securement device, you go under the tubing and on top of the other securement dressing. You pull the tab. You secure that in place. There's a label attached here. You put the gauge, the time, date, your initials, and title. You never want this to cover the insertion site, so you run it on the side of the IV site. Pull off the paper backing. Disconnect your saline. Bring your tubing up. Right here over the wings, that's where you want to secure another piece of tape just to hold that in place. And that's your IV site.